Thank you. All right, thank you, everyone. All right, so we're going to go back to 2003, a long time ago. We're going to go back there. So back in 2003, what was going on? French fries were temporarily named Freedom Fries, right? Arnold was named the governor of California. And Lost in Translation, very good movie, was out in the theaters, and I personally must have seen it at least 14 times. I was also a junior at Marquette University in Milwaukee, Wisconsin. I was working at a coffee shop, going to class, working at a coffee shop, reading a lot, learning from my peers, just doing the whole college thing. So one day, my friend Jeff came to the coffee shop, and he said, "Hey, Shital, I'm going on this trip to Honduras. My next door neighbor is a physician, and he needs some people to translate. I know you speak Spanish. He needs some people to, lug all the big boxes and all the luggage around. Do you want to go?" Now, anything's better than March in Milwaukee, okay? But so I decided, okay, what's there to lose? I have a week off. I'll go ahead and go. So we all boarded this plane. We went on this trip to Honduras. And I thought my role was only going to be just a translator, right? Somebody that is just going to sit alongside the doctor, be able to, just communicate things that the patients were saying, and then probably, hang out with my friends in the evening when the doctors went to bed at 8 o'clock, because that's what I thought they did. And so what happened was something completely different. What happened was the rest of our lives changed. And me specifically, I had an opportunity to see a lot of the things that I was reading about. I was learning a lot about global health in my classes. I was reading a lot of articles, reading a lot of books. Some of them were beyond me, but I was trying to at least look cool and read them. And I saw that everything that I had read about was actually happening in the world. It was happening in front of my eyes. And I, as a student, and as an interpreter at that time, felt very compelled to do something about that, to be a part of that change, right? To make the system better in Honduras. Because the things that I saw were just complete lack of poverty, lack of resources, which resulted in poverty. Saw a lot of inadequacies in just the local healthcare infrastructure. And the biggest thing was just that lack of education. Simple things like washing your hands can limit the amount of disease and the amount of illnesses that you have. And those basic principles weren't there. So as the week went on, we kept talking to community members. We were learning more about them. And so when we got back on that plane to come back to Milwaukee, to come back after this trip, we had to do something about it. We had to get involved. So initially, come back on campus, what's the first thing you do? How do you create a healthcare system as a junior in college? How do you create a system that brings education in improving your health as a junior in college? So I Googled it. I Googled a very simple question. How do I create a healthcare system in rural Honduras? It was scary what came up. I'm never going to do that again. Stopped Googling after that. But what I did start doing is kind of shied away from that and started engaging in a lot of conversation with healthcare professionals. So my personal doctor, talked to him about some of the things that I saw. How would you address it? You're a doctor. Talk to them about, hey, what are the different things that we can do in order to make the healthcare better? Or how can we bring more resources? What type of resources can we bring in? You're the doctor, right? Let me know what we can do. And so I got all this information, and I started thinking about a lot of the things that they were saying. And then comes the next problem. Well, I got all this information, but I'm not a doctor. So where do we go from here? So is there a program that makes you an MD overnight to be able to do those things? I don't think so. I know that there's nothing like that, otherwise a lot of us wouldn't be as stressed out about MCATs and all those things. But what I then realized is that, wait, I don't need to become a doctor just yet. I don't want to wait 8 years to start creating a better healthcare system in Honduras. Why don't I engage people? Why don't I start working with the doctors that I already talked to? Start talking about the vision that we wanted to create in Honduras, which was a very simple vision of creating a better healthcare system in Honduras. And so with that vision, started to bring on these individuals that were also feeling passionate about this. And then we started to build a team. The team consisting of passionate students that really wanted to address some serious issues that were present in health in the communities that we worked in, alongside with professionals who were knowledged, had a lot of professional training to be able to help us develop a program or develop a system altogether. So that was the first step of developing that team. So we continued to go to Honduras more and more. We continued to go to the same communities, see the same patients. And as we met more people and we started gathering more information, we started seeing more patient data, we saw that everyone has parasitic infestations. A lot of people are suffering. A lot of people are coming to the medical clinics that we create for the time because they have waterborne illnesses. And so that started to become a repetitive thing that we saw. And then that's where the bigger question is how do we address the root of the problem, right? The root being, how do we improve the water? So I got stressed out because I'm not a water specialist. I'm not an engineer. And I'm sitting here like, okay, how do we get this done? Well, very similarly to how we started getting to know a little bit more about the approaches of medicine is let's start engaging water experts. Let's start engaging student engineers that are studying this on campus and get them involved and get those brainstorming sessions going with the in-country community members. And let's create a better water system that addresses the parasitic infestations, the lack of chlorination. Just be able to bring potable water to the communities. So they then joined our team. Our team grew from being students to medical professionals, then to water specialists. So now we're addressing a lot of those different things that the patients were coming in for. We also saw that there was a lot of issues with just basic public health type of approaches. Everybody was coming in to the clinics with upper respiratory illnesses because they're cooking over a fire in their homes and there's no ventilation. So they would come in with terrible bronchitis and all sorts of really challenging lung illnesses. And so we thought, okay, well, why don't we think about how to address this? We can't just keep giving a pill or keep saying, I'm sorry, I can't help. Let's actually create a way to address the root of the problem. Another public health type of issue that we saw was just a lot of cross-contamination, right? A lot of issues with human waste disposal. So when you don't have the basic education or you don't have a place to properly go to the restroom or properly dispose of human waste, you're just gonna kind of go wherever's convenient, and it's going to affect the way that your water is, if you have water, if it's clean. It's gonna affect that overall health of yours through cross-contamination. So we then decided, let's develop infrastructure within these homes to help dispose of waste properly, to help dispose of things, to help improve just the overall public health issues that we were seeing in the community. But how do we do that? How do we address a public health issue? We have these ideas, but we want to base a lot of our projects and our programs based on evidence. So we looked around. Was anybody on our team already of water specialists and doctors? Was anybody a public health specialist? Or anybody a public health student that was studying it in order to give us ideas? Not at that time. But that's when we started engaging and started recruiting people on our team in creating a better healthcare system in Honduras. And we brought on public health specialists and we brought on public health students in order to implement projects and be able to look at how our projects are making an impact within the community. We then started talking more to the community members, started doing a lot more education with them, and really learned a lot from them and also be able to share a lot of the knowledge that we had to them as well. And one of the biggest things that came out of that was the community members were stating that it's really hard to do a lot of these things because we're not able to pay for a lot of healthcare services even if we have access to it. And sometimes we feel that if we don't have that financial strength or that financial stability, we're not going to be able to have that mental strength because we don't have that financial strength. And then it affects our physical strength and physical stability. So then I got stressed out again. Well, we need business majors. We need people in the world of business and microfinance and just financial consulting to be able to help educate the community members in those simple concepts of saving, in those simple concepts of how to structure your life or how to be able to plan for things so that you're not just addressing things day by day financially, that you can create that financial stability and create that mental stability, which then creates that physical stability, which is part of healthcare. We started educating a lot more about ourselves, about the communities that we were working in, and we were educated by the community members themselves. We were having conversations with them that focused on, this is how we live, this is what we do, how can you help us? And we started to realize we're learning a lot more from them, right? The whole process of knowledge sharing. And so we then developed a program where we were able to train or have a formal process to train our community members to be able to train their own community members, right? To be able to use our resources of education, use our resources of curriculum development, all these different things, and then be able to have them go through this to be able to share and to be able to educate further people in their communities, such as the youth. Teachers learning more about health and hygiene sanitation so that they can teach the people that they have in front of them, the youth that they have, and the students that they have in their classrooms about those things, so that those concepts are embedded at a very young age and it becomes a best practice and a lifestyle and overall better quality of health. And we built that team. It was a team of, they then joined the team as community members. They joined the team. And so now we have this team of water specialists. We have a team of healthcare professionals and students. We have a team of local educators and educators from other parts of the world joining in to create a better healthcare system. And then we started to see a lot of improvements in the communities over time. Over a few years, we started to see kind of the fruits of the labor, right? We started to see the patients that were getting better. We started to see better in-home infrastructure. We started, walking through the communities. You'd see people washing their hands and little young children talking about talking about those simple things that we were teaching them in school or that the local teachers were teaching them. And we got the attention of the Ministry of Health in Honduras. And they said, whoa, what are you guys doing? Something's working, because all of the information that we're getting from our data when we do that, if we do them, is things are getting a little bit better. And so we had our team, they have their team, and the focus is let's join together. Let's try to see where our gaps are as an organization, and let's see where your gaps are as a local government or as a ministry, and let's join one big team in making change, right? And creating that healthcare system in Honduras that I've mentioned. And so now, we're getting to that point, right? We've gotten to that point, and now it's just implementing that. We've implemented this in Honduras. We're implementing this in Panama. We're also starting to implement this. We're in the beginning stages in Ghana. And I always go back to that initial stress, right? That initial conundrum of, how are we going to do this? We're students. We're young individuals that may not have that expertise. We're not experts. But how do we make that change? How do we create that vision and work towards that vision? And I think that the biggest thing that I've learned in this process is that it shouldn't be just one person trying to do everything. It should be a team of people that's trying to accomplish a goal. And in that goal, today, we've created effective and innovative ways to address the health within the communities, to affect the financial stability within the communities. And that's the biggest impact that we can make. If we as human beings are capable of creating a team and working towards a common vision, we'll be able to make that impact and make that change for the rest of time together.